Hello, I'm Larry Carlson, President and CEO of United Methodist Communities. As summer of 2020 begins, the UMC COVID response team has diligently worked on our reopening plan, the Road Forward. This was a complex and methodical process, which included input from a multidisciplinary team of associates, as well as residents and families. Please keep in mind that this will take time and patience as we understand the risks involved with relaxing the current restrictions. This won't be a flip the switch scenario, but more of a slow, methodical process of opening services. But before we relax any restrictions, we will need to make sure appropriate policies, procedures, and safety measures are in place. Rest assured that the implementation of the plan will be done with the objective of minimizing the risk of the virus spreading. However, we all need to realize that the relaxation of restrictions exposes everyone to greater risk. And keep in mind that if we see a spike in cases at any point after relaxing restrictions, we may have to take a step back to a more restrictive situation. This process is driven by Governor Murphy, the New Jersey Department of Health, and the Centers for Medicare and Medicaid Services, or CMS. CMS specifies 7 distinct factors for states to consider in determining their approach. Case studies in the wider community, case studies in the assisted living or skilled nursing facility, adequate staffing, access to adequate testing, universal source control, which is defined as the kind and use of PPE for residents and visitors, and access to adequate personal protective equipment for staff, as well as local hospital capacity. The Road Forward contains a recommended phased reopening that is crosswalked to the Opening Up of America Again guidelines, but includes additional recommended criteria for moving through the phases. Among those additional recommendations include skilled nursing and assisted living communities should not be eligible to commence the reopening process until all residents and staff have received a baseline test with appropriate actions taken by each building in response to those results. UMC began testing their residents and associates before the state requirements began, so we already have the necessary baselines. State survey agencies should survey those communities that experienced a significant COVID-19 outbreak prior to reopening. And I'm pleased to say that all our public health surveys that had taken place since the outbreak began have been deficiency-free, meaning that our infection control processes are strong and our teams are vigilant. And lastly, each phase of the reopening should lag each phase for reopening by the broader community by 14 days. We know we are all anxious to get back to normal, but this is a fluid process that is subject to change as we get new guidance from CMS and the Department of Health. Our phased approach has 4 stages defined as the red zone, orange zone, yellow zone, and a green zone, each being less restrictive than the one before. The red zone is the most restrictive. This is the lockdown situation with the highest level of vigilance, irregardless of the virus transmission rate within the building. No visitors are allowed except for compassionate care, resident movement is restricted, and associates are tested weekly. We are discouraging visitors to the homes of our HomeWorks clients. We've been in the red zone since March and know how hard it has been for our residents' families and associates. Our teams in our full-service communities have been proactive in keeping our residents engaged with Zoom and FaceTime calls, hallway activities, and birthday surprises. Zoom meetings with families have kept them informed about what's been happening inside the community. We know it's been a struggle though. As New Jersey begins loosening restrictions, we should be able to follow behind to the orange zone. The orange zone requires no new cases for 14 days of residents or associates. Asymptomatic residents in both our full-service and senior housing communities are allowed movement within the building with masks and social distancing. Visitors will be allowed into the building for compassionate and well-being visits, and visitation booths will be available by appointment at all full-service communities. The salon may open, and worship with limitations can resume. If a resident leaves the building for a medically necessary trip, they must quarantine for 14 days upon their return. Independent living residents at Bristol Glen and our senior housing communities can travel in their own vehicles. Our Tapestries residents will be able to have meals in their household dining room, depending on the situation. Social distancing required, of course. Movement to the yellow zone requires another 14 days of no new cases for residents or associates. Asymptomatic residents are allowed full movement inside and outside with masks, and visitation will be allowed with screening and additional precautions, including social distancing and hand hygiene. Visitors are allowed in the homes of our HomeWorks clients. All visitors must wear masks for the duration of their visit. Residents in our full-service communities are still screened daily, and associates are tested weekly. Skilled nursing and Tapestry residents will be permitted to engage in small group activities and participate in sightseeing trips on buses pursuant to social distancing measures. Assisted living and independent living residents will be able to get off the bus in remote locations, like the park, for some summer sun and fresh air. Assisted and independent living dining rooms are open at reduced capacity. The bistros are open in all communities with pre-order and takeout available. The green zone, or the new normal, happens when there have been no rebound COVID-19 cases for the past 28 days. No staffing shortage, adequate PPE supply, there's adequate cleaning and disinfectant supplies, and access to testing. And the referral hospitals have capacity. At this point, most restrictions will have been lifted in the wider community. Residents will be free to come and go, in and out of their own community. There are no restrictions on visitation or travel for our HomeWorks clients. The dining rooms and bistros are open at full capacity. However, masks are still required in many cases, with appropriate social distancing. You can visit our COVID-19 response page on our website to see our Road Forward document. We'll be looking at each community and our home care division with separate plans and timelines, depending on each local situation. In some cases, different parts of the community may be in different zones at the same time, depending on the Department of Health directives and the current virus status. This isn't always forward progress, but back and forth movement. If at any point we have a resurgence of positive cases, we will be forced back by regulation into the red zone to start the process again. That's why vigilance and being mindful of who we all associate with is paramount. We must make every effort to keep COVID cases out so we can continue moving ahead. And you play an important part in us achieving forward progress to the next less restrictive zone. Who do you allow in your bubble? In other words, who do you trust to allow into your life, hoping they will not infect you with COVID? We must be mindful of who we allow into the UMC community or HomeWorks bubble, which is why restrictions loosen slowly. It's a matter of personal responsibility and trusting everyone to do their part to ensure our bubble is as secure as we can make it. A step back will impact everybody's quality of life. We know we have a long journey ahead of us, but won't stop until our communities are open to visitors and residents can resume their abundant lives. So thank you for your support and vigilance. We can't do this alone, and I'm counting on you to do your part so we can open our buildings safely. Together we can ensure our UMC family experiences a bright future.